Assalamu alaikum, everybody. I'm really excited to have Hina Asad here, who will be guiding us through the process of careers in nursing. So please take it away. Thank you, Hina.
Assalamu alaikum, everyone. I'm here to present on the field of nursing. So I will begin by giving you a brief overview of my role and my career path. I am a director of clinical supervision for a home health company here in Southern California. The home health company is called Accent Care Home Health. We are the fourth largest home health company in the country. We have about 8 offices in the California area, and I supervise the nursing and physical therapy staff. We gear our services towards patients who are homebound and are unable to leave the home and require nursing, physical therapy, speech therapy, or occupational therapy. That's a little bit about what I do. I'll now start my presentation on the career path of becoming a registered nurse. So, first of all, I would like to emphasize that nursing has a lot of different options, and even if you're not interested in patient care, there are a lot of other things that you can do. Okay, so I have a bachelor's degree in education, and I went back to school and received my Associates of Applied Science in Nursing. I have 8 years of experience in home health nursing. Started off as a behavioral health nurse in a psychiatric hospital, then came into the office and became a clinical supervisor for the same home health company, and then took on the role of the director of patient care. Now, there are many different career paths and education paths within the field of nursing. The first option is an associate's degree in nursing, which is a 2-year program. It is referred to as an ADN. Or the second path is a Bachelor of Science in Nursing, which is a BSN program, which is a 4-year program. Any program that you seek out, you should ensure that it is accredited by these 2 bodies, the Commission on the Collegiate Nursing Education or the Accreditation Commission for Education in Nursing. Once you have completed your education, a requirement to function as an RN is to pass the state boards, which is referred to as the NCLEX exam. The Council of State Board of Nursing administers that exam. That is a pass-fail exam taken on the computer. You can take it as many times as needed in order to pass. Once you've completed your program, you will register to take that exam. You can take it 2 months after the completion of your program. You can take it 6 months after the completion, whenever you're ready. Once you have passed that exam, then you will be able to practice in the state that you took your exam. Okay. Now, nursing is a very vast field, but like any profession, there are certain aptitudes that will allow you to be more successful as a nurse. And some of these aptitudes one would think are pretty basic, but you would be surprised at how many people enter this field and may not understand the impact that these aptitudes have on you to do a good job. Empathy. It is so important to be able to empathize with your patients and your patients' families. Regardless of whether or not you can relate, you have to be able to empathize with what they are going through. Many times the decisions that they make may not be the decisions that you agree with, but it is very important to put yourself in their shoes and exhibit an empathetic factor. For example, a family may decide that they want to go the hospice route. You may not agree with that, but it's important for you to exercise the utmost empathy in supporting that decision. The second aptitude is caregiving. It's very important to be an individual who finds comfort in caring for others from a holistic perspective. The third is decision making. It's critical to be able to make decisions not only at the last minute, but decisions where you have, spent a lot of time critical thinking through the effects of your decision making, the short-term effects, the long-term effects. For example, if you are an emergency room nurse, decision making is critical. In a very short period of time, you're given a lot of information and you have to basically make a decision based on that information, be comfortable with your decision, be able to articulate your decision. Fourthly is organizational skills. As a nurse, there are numerous demands on your time, not only from a medical standpoint, but from an administrative standpoint, from a patient family standpoint, from a bureaucratic standpoint. So you have to really be able to organize your thoughts, your ideas, your decisions in a way that is most effective to yourself and those who you are treating. Teamwork. Very few nurses operate in a silo. Most nurses work as a larger unit, and the ability to function as part of that unit is critical. You may be working with social workers, with pharmacists, with doctors, with occupational therapists, with physical therapists, with a hospice team, with a clinical surgical team, with an anesthesiologist, with supervisors, with nurse educators. So the ability to really exude teamwork will not only help you, but will affect the whole team. Communication skills. Nurses have to document a great deal. So the written communication skills, I would say, is integral. Once you have completed a task or once you have met with a patient family, the need to document all of that information, which is considered a legal document, in such a way that not only reflects, what you did accurately, but also reflects the reactions to what you did, the implications of what you did, and the ability to not only have that in a written format, but the ability to actually verbalize it is very important to protect your own license as well. Attention to detail. Everything from, ensuring that the right amount of IV solution is administered to the patient, ensuring that you have really attended to all of the vital signs, ensuring that every little piece of information about that patient is taken into account in their plan of care. So a lot of attention to detail. Here I just captured some of the, most important aptitudes for nursing. But as in any profession, there is so much on a daily basis that will help you to be more successful. In terms of interests and skills, in order to pursue the nursing career, you really have to have an understanding of how the body works, the disease process, anatomy, physiology, cause and effect. If A, then B. If something is going on in the body, could it be related to a medication? Is it the effects of a disease process? So a real basic understanding of science is very important. Investigative personality, trying to not only see what's in front of you, but peel away the layers and understand what the possible causes are, effects are, what's going on, what's the big picture. It's not just what I see, but there are so many other factors. So it's a lot of CSI work, if you will, being able to put together the pieces of a puzzle and not just look at directly what's in front of you, which ties very much into the problem solving. Nursing is a very fast-paced environment. There are often times when you have to think on your feet. You don't have the time to say, well, let me ponder on that and come back. tomorrow with a decision. Often you need to make a decision within minutes or seconds, and the ability to not only justify your decision, but have an understanding of all the components that came into play to make that decision. Once again, that analytical personality, understanding the relationships between systems, understanding that a cardiac issue may be impacting a neuro issue, understanding that a patient with psychosocial concerns may have other disease manifestations. And that's also very tied into holistic care. You don't just treat the patient, but you treat the family, you treat the extended community, you treat the experiences that that patient has brought to you. Earning potential. Earning potential of nurses varies from state to state. California does have one of the highest salary ranges for nurses in the country. And the southern states tend to be on the lower side of the income bracket. This is, once again, it is a range. Please do not hold me to any specific numbers. These vary from not only state to state, but hospital to hospital, organization to organization. New grad programs look very differently in certain states than they do in others. It also has a lot to do with some individuals actually where they do their clinical or their practical program in the last semester of nursing school tend to get hired onto that program. So that might look very different than someone coming in from another state and applying to a new grad position. The average retirement of a nurse is 62. Often what happens is those nurses that are doing hospital or bedside nursing may choose a different career path once they feel that they may not be able to physically continue the demands of hospital nursing. And there are plenty of opportunities after that career, after that hospital career path may be outdated. So once again, these are just ranges. Here I put in a map just to give you an idea of what nurses make throughout the country on average. And this is an experienced nurse, obviously. And by experienced, I'm saying anything beyond 3 to 5 years. So as you can see, there is a great variance between like California to maybe one of your southern states like Alabama. So that kind of gives you an idea. Okay, work-life balance. There are many options in terms of work-life balance for nurses. For example, I work remote. I have been working remote for the past 4 years. I work very much a 8 to 5 schedule. However, hospital nurses, clinic nurses, many work 12-hour shifts where they do 3 12-hour shifts back to back maybe, or 3 12-hour shifts Monday, Wednesday, Friday, and then get 4 days off. That is a traditional nurse schedule. There are also hospitals that do shifts like a 7 to 3, a 3 to 11, 11 to 7, 3 8-hour shifts. So there are many different options. Many places also have on-call requirements where you are required to be on call maybe 1 weekend a month, or 5 weeknights, or every other weekend. So depending on the facility that you are working with, there is an on-call requirement. For example, my role, I do an on-call where once a month I take triage phone calls as needed for home health. So like I said, every place is unique. I do urge you that when you do interview for positions, you do inquire about the on-call requirements, because that is something that for many people makes the decision as to whether or not they will take that position. Trends. So the need for registered nursing is expected to grow exponentially in the next 10 years. And just as the previous speaker had said with regards to healthcare, the need for nursing, pharmacists, I would say adjunct healthcare and individuals will continue to skyrocket. As a country, there will always be a need for any healthcare field as we witness our population aging and continuing, unfortunately, with significant health needs. Okay. Geography. The demand for nursing is really, I would say, pretty standard across the country, but there are states that have a higher demand than others. Alaska, California, Texas, and New Jersey. And of course, California and Texas, just by nature of the population. Alaska also has a high demand for nursing because it is an area that not every individual wants to reside in. So that will also see a huge increase. New Jersey as well, and I would assume this is related to also the pharmaceutical corridor there. Travel nursing is also an area which will continue to be in high demand, where a travel nurse may do a 3-month stint in Puerto Rico, another 3-month stint in Alabama, another 3-month stint in Alaska. Wherever the need is, they travel to those particular states. Here is also a chart of the states and the demand. As you can see, the top 3 are California, Texas, New Jersey. So that's just something to give a quick look over to. The work environment. The work environment in nursing really varies from a hospital to an office setting. By an office setting, I mean, there are nurses that work for insurance companies and law firms, legal nursing, where, you would review documentation for perhaps a case. You would review documentation if you're working for an insurance company to see if that patient, was eligible for the insurance to cover a particular procedure. So those are very traditional office settings. Then there are hospitals. Then there are surgery centers, where when you go in for an outpatient procedure, when you go in maybe for a colonoscopy, you go in for a cataract surgery, all of those individuals are RNs working in the surgery center. Cruise ships, schools, most schools employ a school nurse. Community health programs. Community health, I mean, like perhaps the Planned Parenthood, mental health clinics in the community, early childhood WIC programs. Those are all community health. Dialysis centers, DaVita, all of those employ RNs. Long-term care centers, which would be assisted living, nursing homes, rehab, then public health agencies, acute care settings, and rehab centers, which I've kind of mentioned. So there is a vast number of work environment options. Attire could be scrubs or business casual, once again, depending on your facility. If you work in the OR, for example, of course you would be in scrubs. But if you work at a school, business casual probably be very appropriate. So once again, depending on the setting you work in. So that is basically a overview of the nursing profession. And I'd be glad to answer any questions.
Yes, thank you very much, Hina. That was very helpful. There are a few questions that we have. We'll start off with Hassan. Hassan, go ahead, please.
I have two questions. My first question is, as a nurse, can you do some procedures that a doctor does?
No, we cannot do any procedures. We would obviously assist, but we cannot prescribe medications, nor can we diagnose, nor can we perform any procedures that a doctor is specialized to do. However, within the field of nursing, there are procedures that are within our scope of practice. So when you say procedures, I thought of, we couldn't do surgery, but procedures that a nurse would be able to do would be, for example, IV care, G tubes, catheters, wound care. So all of those would be under the TPNs. All of those would be under the field of practice for a nurse. Wound vacs. So we could do all of those. But something specific for an MD, we would not be able to do.
Also, what are some major challenges you currently face right now?
So right now, one of the major challenges that the nursing field is facing is that we have a shortage. We have a huge shortage of nurses. What's happened is a lot of the baby boomers and the nursing population is aging, and we are not able to meet the needs quick enough of a population that is getting sicker and a geriatric population that does not have accessibility to caregivers. So one of our biggest shortages right now is we cannot keep up with the demands. Not enough nursing graduates to fill the positions.
Thank you.
So we had one more question. So nowadays, doctors in some hospitals are putting up a wall. Before you get to them, you have to go through a nurse practitioner, and there's no way out of that. And then you have one doctor who's got 5 nurse practitioners reporting into them. So are those nurses? Are they different? And because they prescribe medication and all as well.
Right. A nurse practitioner does have the ability to work directly under a physician and prescribe medications.
So what is a nurse practitioner? Is a nurse practitioner a nurse, or is that some extra thing you have to do?
So a nurse practitioner is an additional program. A nurse practitioner is, it's closer to a physician assistant program. So it's an additional, I believe, 3 years. And you would specialize. You could be a family nurse practitioner. You can be a nurse practitioner within a particular specific field. So it is a much more detailed program.
So do you have to be a nurse to be a nurse practitioner, or no?
Yes, you do.
First, you get your nursing degree, and then you do 3 years more of nurse practitioner, right?
There are some programs where you can, they'll combine everything, where you can, for example, let's say you have a bachelor's degree in sociology and you want to become a nurse practitioner. There are certain programs where it's a bridge program where you can attain that nurse practitioner program within that program, like a 2-in-1, so to speak.
Got it. Okay, thank you.
And if there is an individual who's particularly interested in the nurse practitioner program, if you provide my email, I would be happy to connect them with someone to get more details on that.
Okay, thank you. All right, Hassan, go ahead, please.
Yes, as a nurse, do you have on-call requirements?
So that really depends, brother, on the area in which you are working. Most hospitals do have on-call requirements. If you are working in a surgery center, for example, you may or may not. If you are working in an office setting, you likely would not. As a home health nurse, you do have on-call requirements. So I would say the majority of nursing positions do require some sort of on-call requirement.
Thank you.
Mohammed, go ahead.
How much does it cost to gain a bachelor's degree in nursing? Also, how long does it take?
So as the brother had said previous, the cost really depends on if you're going to go to a public program or a private program. If you are going to do obviously a 4-year, a bachelor's degree in nursing would be a 4-year program. And the cost really could be anywhere, from per semester at like a $6,000 per semester to a $13,000 per semester, depending on the type of program. I really encourage those of you, if you're looking to do a bachelor's, to see if you can hook up with a hospital that may provide tuition reimbursement. Maybe you start off, where you do the associate's program, and then, which is a 2-year program, get in with a hospital, and the hospital may actually do tuition reimbursement, where you not only look to do the bachelor's program, but maybe do a master's, and then they require you to work for them 2 years or 4. You sign a contract, and then they also require you to perhaps work, even during the course of your school. But a lot of hospitals provide tuition reimbursement because they really want to invest in their own staff, in their own nurses.
Okay, thank you. Was another question, Mohammed? Your hand's raised. Go ahead.
Yeah, so after the 2-year associate, is it easy to get a job as a nursing in the hospital setting and then do the bachelor's and the master's program with the reimbursement that you was talking about?
It is, and it is more so if you're able to get a position in the same hospital that you do your internship with, brother. And then if they know that you're invested long-term, they are more likely to hire you into their new grad program and provide reimbursement for a bachelor's degree in nursing. So once again, it really depends on the hospital. The more smaller hospitals are more likely to hire an associate, and then you can really develop a long-term plan to remain in that hospital.
Okay, thank you. Ali Hassan, please go ahead.
So I've heard that so registered nurses
A lot of background noise. We're having a hard time.
I'll type it.
Yeah, go ahead. Hassan Haider, go ahead in the meantime.
Okay, what advice can you give to someone who's looking forward to becoming a nurse starting from now?
I would probably say that it's never too early if you're looking to start a nursing program to start scoping out potential employment opportunities and connections within the nursing field. So even if you can, start off by volunteering at a hospital or a surgery center or a public health clinic, I would start doing that so that when you get to the point where you've completed the program and are looking to start working, they already have an investment in you, or they're already able to recognize what you can offer them.
Thank you.
Great. And Ali Hassan had a question. His question is, I've heard that registered nurses are higher than normal nurses. Is that true?
So by higher than normal, let me just preface that there are also something called LVNs or LPNs. That's a licensed practical nurse. That is I would say it's a different program. I believe it's like a 1 or 2 year program. So a licensed nurse works under a registered nurse. So in terms of nursing qualification, there's a huge difference. It's the difference between an LVN and a registered nurse. A registered nurse supervisor is an LVN. LVN, there's a lot of like an LVN cannot do IV care. There are certain tasks that an LVN cannot perform. It has to be under the supervision of an RN. So yes, to your question, the scope of practice for a registered nurse is a lot vaster and wider than that of a licensed practical nurse.
All right, thank you for that. And then we have another question. Do you know if it's possible to volunteer at a hospital as a high school student? If so, what can we do to take initiative, and can you shadow a nurse?
So yeah, it's very possible. There are a lot of hospitals that welcome volunteers. So that's something I would highly encourage. In terms of shadowing a nurse, with regards to HIPAA, which protects patient privacy, that's not something that's always realistic and reasonable. That's why I would encourage volunteerism, because even if you volunteer, let's say in a hospital on the med-surg unit, although you may not directly have the opportunity to shadow a nurse, at least you get an idea of a day in the life, some of the tasks of a nurse, some of the challenges of their day, their role, and that gives you an opportunity to see about probably as close as you can what the nursing profession offers. So I would highly encourage you, don't just think about hospitals. There are other, a lot of public health clinics. There are opportunities to volunteer.
Awesome, thank you very much. Any other questions? Oh, there's one more question about how is the life of a nurse different in a hospital versus a corporate environment? Like what are the major differences there?
So first and foremost, a hospital environment is a much more physical environment. If you're doing 12-hour shifts, you're on your feet for the majority of that time. You may be handling, depending on your patient-nurse ratio at that hospital, 5 or 6 patients. It is a lot more, I would say, intense physically, mentally. A corporate environment has a different sort of feel. It may not be as physically draining, but the demands on your time can be equally taxing. But it's kind of comparing apples to oranges, completely different work environments.
Okay. Thank you for that. One more question. Do RNs help in surgeries?
So yeah, if you are a OR nurse, if you are an labor and delivery nurse, if you are a med-surg nurse, if you're an ortho nurse, depending on what your specialty is or the unit you work on, you would be required, of course, to assist in a surgical environment.
Okay. And one more question about nurses. Is this traditionally it's been a women-dominated field, so do men have a hard time getting jobs as nurses, or are they like looked down upon as nurses?
Actually, it's quite the opposite. As a male, if you're looking to get into the nursing profession, you're really in a highly coveted position. Hospitals and all healthcare settings are looking to really welcome men in this field more than ever. So if you're a male, you are at an advantage, actually, as opposed to a disadvantage.
All right, that's good. And one more question we had was, let's see here, which hospitals hire the most nurses? I guess the question relates to maybe a company or a geography, I'm guessing. Or which is the largest employer of nurses? I think maybe that's a better question.
So for us in California, Kaiser is one of the largest employers for nursing. It's also one of the most challenging hospitals to get into. But I would say it would probably be for California, Kaiser. Any large hospital system that is in your state is going to be probably the largest employers, because they also have one of the most sought after best new grad programs as well.
Okay. And then we had one more question about competition from abroad. There are a lot of nurses who have come here on a work visa, say from different parts of the world, like Philippines specifically. So if you are born in the US and you went to school here, are you at a disadvantage or are you at an advantage, or it doesn't really matter?
You know, it's a very competitive environment. There's no question about that. I think that, once again, I can't emphasize enough the importance of trying to form alliances and relationships early on in your program so that when it comes to hiring, they're more inclined to choose a known as opposed to an unknown. It's a very challenging environment when you have so many foreign nurses. I can't say that you're at a disadvantage. I definitely don't think you're at a disadvantage, because there are a lot of the foreign nurses choose hospital settings. So if you're looking for perhaps a non-hospital setting, you are in an advantage, because a lot of the nurses that come from foreign countries are looking for, doing those 3-4 hour shifts back to back and then having those 3 days off. And that's really where, especially night nurses do very well economically. So a lot of the foreign nurses are going to choose those sorts of shifts. So there are other options available to those of us that don't fall in that category.
Okay. Any other questions, folks? I think I covered most of them. Oh, we have Hassan who has his hand raised. Go ahead, Hassan.
Are nurses really respected in society?
Okay, that's
So that's an interesting question. And I'd like to, I think one of the things is I would question what society, right? Number one. Number two, I think that there is very much a misconception about the field of nursing. For myself, I have never done direct patient care in any capacity. I've always done more the administrative side. And so I think the respect comes from the lack of understanding or knowledge of a nurse's role. I think it's very important for us to continue to educate in order to build the respect of a nurse, because a nurse is really that fundamental brick of patient care. So to answer the question, A, what society? B, it's our role to educate individuals. And C, there are so many different options in nursing other than direct patient care. And I am an example of that.
Thank you.
All right, Mohammed Abbas, go ahead.
Is it easier to become a doctor after you become a nurse?
So two very different fields, right? I would not recommend, going into nursing and then becoming a doctor, only because they're two very different aspects of healthcare. They do two different things. So, two different ends of the spectrum, depending on your interest, depending on how you want to serve, depending on your career path.
Okay, thank you. Any other questions? No other questions? Oh, there was actually one more. What are the opportunities? Are nurses who are trained in the US recruited outside the US, like in Europe or Middle East, aggressively, or is there a demand for that?
No, they're not recruited aggressively outside of the United States.
Okay.
There's too much of a need here, really.
Got it. Okay. Awesome. I think that covers all the questions. Folks, any other last questions? We've got
one last question.
Yes, go ahead.
Do you work more often since now the coronavirus is here, or no?
Yes, we have a lot of staffing shortages due to the coronavirus, so we are exponentially more busy.
Thank you.
great question. I know nurses are frontline workers, right? So they've been impacted disproportionately because of the virus. They've had to, right? I mean, can you share some stories, you know, about that?
So yeah, we have been significantly impacted from a home health perspective. We have nurses that, you know, we're not comfortable going into the home and seeing patients with COVID. So that created a nursing shortage. We had nurses that perhaps they themselves had an immunodeficiency and were not able to see COVID patients. That created a shortage. So there was a huge impact. Huge impact.
Awesome. Thank you very much. Perfect. I mean, this was perfect. Thank you very much. You know, in terms of time, I think you're right on the dot. So thank you everybody for attending, and thank you again, Hina, for taking time to talk to us. This was very useful. We'll make the recording available on YouTube and we'll share it with all of you in the next week or two. But if you have any questions, feel free to reach out to her. I think she provided her email right in the presentation. And if you don't have it, you know, you can reach out to me and I can give that to you if she's okay with it.